You've probably heard it before that inflammation is the root of all disease. This phrase has been tossed around for years, but how true is it really? While it certainly does play a significant role in chronic illness and in autoimmune conditions, like most things, there's more to this story. So, chronic inflammation is deeply involved in conditions affecting not just the gut and the immune system, but also the brain and the nervous system. This is the case with diagnoses like autism, ADHD, anxiety, and even epilepsy. Traditional medical doctors, they'll often turn to medications like NSAIDs and corticosteroids to help combat that inflammation, while integrative medicine doctors may prescribe intense diet changes, detoxes, or a host of vitamins and supplements. And despite these efforts, many patients, especially our children, continue to suffer. But why? Because there's an even deeper and often overlooked root cause, and that's stress and dysfunction in the vagus nerve and the autonomic nervous system. Chronic stress is the number one hidden in plain sight cause of inflammation, even in our kids. Yet no amount of lab testing or blood work is going to reveal stress and dysfunction in the vagus nerve and the autonomic nervous system. And this oversight can leave parents feeling stuck in a cycle of temporary fixes that don't address the true root cause of their child's health issues. So today's video is for parents who are seeking answers and drug-free solutions for their child's chronic health challenges. So if your child struggles with inflammation, with gut problems, with sensory overload or mood swings, and you feel like you're piecing together solutions all on your own, keep listening to uncover the role of the nervous system in your child's health. While gut health is crucial and is often a major focus in treating chronic inflammation, it's not the whole story. Parents are often guided to remove gluten, dairy, grain, sugar, and toxins, while adding in diet changes, detoxes, vitamins, and supplements. And while those steps are all good and helpful, they are often incomplete without addressing nervous system stress and vagus nerve dysfunction first. More often than not, the vagus nerve is the missing piece. It's the longest cranial nerve running from the brainstem to all of the major organs like the heart, lungs, and the gut. It coordinates the parasympathetic rest and digest response, which is crucial for activating the body's self-healing processes. And when the vagus nerve is interfered with, often due to subluxation, the gut and immune system dysfunction starts to occur, allowing inflammation to persist, even with the best diets and lifestyle interventions. Neurological insight scans, particularly the neural thermal scan, can detect areas of subluxation, of nervous system interference, of inflammation and temperature changes within the nervous system, indicating vagus nerve dysfunction. A second test that we use is called heart rate variability, or HRV, and that measures the balance between the sympathetic and the parasympathetic nervous systems, which reveals dysautonomia in the body's ability to manage stress and inflammation. These scans provide us a comprehensive view of nervous system health, helping us to identify underlying issues that might be causing chronic inflammation. Approximately 27% of children in the United States today have a chronic condition, and 1 in 15 have multiple chronic conditions. And research indicates that the prevalence of chronic conditions is rising among pediatric patients. This is suggesting that the traditional medical system is just not keeping up when it comes to caring for the health of our families. And while inflammation is a significant part of chronic illness in kids, there must be more going on that's not being addressed by conventional or even biomedical approaches. So if your child is struggling with inflammation-related symptoms such as immune or autoimmune disorders, autism spectrum disorder, anxiety, seizures, or other neuroimmune-related health challenges, it's time to look beyond just managing those symptoms and adding in diet changes. Balancing the autonomic nervous system and optimizing vagus nerve function is essential for resolving these persistent inflammation challenges that don't respond to traditional or biomedical interventions. So if you're tired of seeing your child sick, inflamed, and struggling, despite trying everything, give us a call to schedule your nervous system dysregulation and vagus nerve dysfunction scans. Let's work together to help your child heal from the inside out. You can reach out to Foundations today to begin this crucial step in your child's health journey. And if you're not local to us, check out the PX Docs directory to find a local PX Docs that's near you. Your love and your dedication to your child's well-being will make all of the difference. So keep learning, keep advocating, and keep believing in your child's ability to heal.